The SLP enters Amal's room for the day's session. Galada is also in the room.
Hi, Amal. How are you doing today?
Ask my brother.
We are okay. We just have some questions about her speech and the next steps that we need to take.
We can talk about her speech and some communication devices that may be helpful in moving forward to help Amal. If you have any questions, please stop me, as I know this can seem like a lot of information. With Amal having severe apraxia of speech, we are seeing inconsistent airs, slow rate, effortful speech, and groping of articulators, which makes it hard for her to communicate.
So, what does that mean for her future?
While there is no cure for apraxia of speech, there are treatment options available to assist Amal with her communication needs. A popular option for severe cases is augmentative and alternative communication, commonly known as AAC.
What are some AAC options that would help me?
Galad looks to his sister with confusion.
I know you mentioned before your accident that when others had a hard time understanding your speech, it was helpful to use your phone as an aid. An AAC device would be similar. It would be a tool you would keep with you to help you communicate when you are struggling to express your thoughts verbally. There are different types of AAC that we can talk about, and you can choose which option would best suit you and your future.
But how do we know which option is best for Amal? She does just fine using her phone to communicate.
I'm glad you brought that up. While Amala has been able to use her phone in the past to communicate efficiently, going back to school and working with patients all day, she needs a device that is a good fit for her educational goals and functional needs. There are two options I think would best fit Amal, both of which are high-tech speech generating devices, either a visual scene or a tablet where she can formulate sentences. There are multiple AAC software options available for tablets. We can trial different ones to see which best fits your communication style.
That sounds interesting. So, can I use it to communicate in Somali?
Well, unfortunately, it does not come pre-programmed with Somali language. However, we can personalize the device to fit your needs and communication style.
So, is this AAC thing going to talk for her?
When someone uses an AAC device, they're in full control of their device and choose what they want to say. The device does have voice output so that others can hear the words the device user is choosing to say, but Amal would be selecting words and formulating her own sentences.
I just want people to be able to understand me and go back to school soon. If I use AAC, does that mean I shouldn't use my voice anymore?
Even though you would have an AAC device to aid your communication, you can still use your voice whenever you choose to. This device is to help you when you are struggling to convey your message with others, which can be frustrating. My job is to provide you with options to help you communicate. The AAC device will provide assistance in more ways to communicate your thoughts and needs. I am recommending that you still attend speech services to work on your speech errors while also learning how to use the device. I'm going to step out the room and give you some time to think about which option you want to try. I'll be back in a little bit to discuss. Please take all the time you need.
The SLP leaves the room.
So, what are your thoughts? I think this is all ridiculous.
I just want to go back to school and get back to my old life.
I don't want something to talk for you and have a robot voice. In our culture, the man of the household does the talking and makes the decisions. I don't agree with the SLP about needing this device.
You're not going to be able to speak for me in school, and I need a way to communicate for myself. This AAC device could really help me in school.
I still don't know if this is the right choice for you.
Come on, you already speak for me in public. I need a way to communicate when my symptoms are too severe for others to understand me, and when you are not around to assist my communication. I need this device to get back to my normal life.
The SLP enters the room.
So now that you have had some time to discuss, what are your thoughts?
I am not 100% on board, but Amal seems to think that trialing devices will help her get back to her life, and I want to support her.
Great. We will start targeting them our next session.
End of scene 1. Beginning of scene 2. The neurologist, physical therapist, professor, SOP, and medical school department head enter a conference room.
Hi, everyone. Thank you for coming today. We have the department head and one of Amal's professors here to discuss her plan to return to school. Would anyone like to start this discussion?
We're meeting today to determine if Amal is able to return to medical school. I want to start by talking about the physical demands of medical school and if Amal is capable of meeting these demands to continue.
Amal has already moved from a wheelchair to a walker. We are hopeful that she will be able to walk independently soon, with continued physical therapy services.
How long until Amal will be able to walk on her own? There are a lot of physical demands in my classes.
She will most likely need a few more months of rehabilitation, not only in physical therapy, but other therapies as well. There is no specific timeline, but we are hopeful can make significant progress to get back to where she was prior to her accident.
You mentioned other therapies. What is being done to help her communicate? She already struggled with this before the accident.
Amal will be trialing augmentative and alternative communication devices in her upcoming sessions to aid her communication breakdowns. She will need time to familiarize herself with the device, but once she does, she'll be able to effectively use her device to communicate with patients, professors, and others.
So you're telling me what needs to be done, but at this time, is she able to return to school?
At this time, on behalf of the entire medical team, including the neurologist, nurse, PT, OT, neuropsychologist, and social worker, she is not in a position to return to medical school and clinical experience. She should be reevaluated in the future, and accommodations should be provided for her as long as they do not affect patient care. Once she is cleared by PT to do the fitness for duty evaluation, a reassessment of Amal's reentry for medical school can be discussed.
Before we leave, I want to emphasize that none of the information we have discussed today means that Amal is not going to be able to return to school. She is showing strong motivation and is one of the hardest workers.
That's good to hear. Please let her know that her classmates and I are rooting for her.
I will make sure she hears that.
Thank you for talking to us today. We understand that she has a long road of recovery ahead. We'll look into accommodations to bridge the gap for academic and clinical settings and be in touch with you for a reevaluation for reentry.
End of scene 2.